Thanks, Sarah. I'll introduce myself a little bit more, I guess. My background is as a nurse. I come from an emergency department and intensive care background. I work in Canberra, and I've always worked in Canberra. In those environments, I've held various roles, a clinical role, an educator role, I've been a researcher and a clinical manager within those environments. It's only in the last 12 months or so that I've made my way across to the university. I have a keen interest in research, education, and in particular clinical practice within the disaster environment. This stemmed mainly from my role within St John Ambulance. I've been involved with St John Ambulance as a volunteer for about 19 years or so, most recently holding the position of Chief Nurse. In that role, I did some national coordination and movement of health professionals during some recent disasters within Australia, in particular around the Victorian bushfires and also around the Queensland extreme weather events that we had this year. So that's a little bit about my background. I haven't done any overseas deployment or disaster stuff. However, since completing my Masters about 5 or 6 years ago, I've been undertaking research and wanting to know more about and get a better understanding about what it's like to work in a disaster environment, how we can better prepare people for that, highlight some of the realities around working in disasters. So that's kind of where I'm coming from. And today we're going to talk about some of those issues and concerns, hopefully be a little bit candid and open, hopefully be a bit interactive and engaging so you just don't all fall asleep at 8 o'clock in the morning. So, first of all, who can define what a disaster is? You're all asleep. This is the interactive part. Who can define disasters? Anybody? Nobody can define a disaster. Okay, that's probably, yeah?
Unforeseen tragic event.
An unforeseen tragic event, yeah. Anything else? Think about disasters from different perspectives. Yeah, you could have disasters from a health perspective that impact on health systems, affect outcomes for patients, health workforce, etc. You could also have disasters from an infrastructure perspective, like disasters relating to water, communications, rail, road infrastructure, etc. Payroll. I've been warned not to talk about payroll. So, it results in tragedy, perhaps. What do you know about these other kinds of disasters? Because I would argue that in Australia we probably haven't really seen a health disaster. We've seen other kinds of disasters, ones that impact on rail and road and communications and water. So it exceeds the abilities of the local community, and they normally then rely on resources, human or physical or material type resources from outside their local community. Yep, so that's true for any type of disaster, health or otherwise. So, for my presentation today, what I want to do is define disaster. We're going to talk a little bit more about that. I want to talk about willingness and people's willingness to help in disasters, because it's important to understand that. In addition to willingness, talk about people's ability, because although people may be willing, they may not be able. Talk about education. I want to focus my talk around education for health professionals and particularly nurses in disasters. Talk a little bit about resources and availability of resources, what kind of resources you may need. Also focus on the role, and in particular talk about roles in relation to education. And then just touch on another few things as we go along. So, disasters. When we talk about disasters, there's normally a series of elements or factors that occur prior to a disaster occurring. So, I'll use the example which I used at the Passionate About Practice conference, and sorry for those people that were there, this will be a little bit repetitive. And I'll use the example of a tsunami. So think of a tsunami, okay? So we've got an island surrounded by water. The hazard in this event, potential event, is the water itself. It's a hazard. It's also a risk. There's a risk or potential that water levels may rise, flood parts of this island. Yep. An event. The event is obviously the tsunami occurring, which results in some kind of impact. Now, the outcome and damage or destruction resulting from that depends on a couple of things. The type of disaster, we're talking about tsunamis at the moment, but also about the society. So the damage from a tsunami that hits an isolated island that's uninhabited, do we really care about, from a health perspective at least, the damage that results? Probably not so much, because there's no one living on that island. If it's the Indian Ocean tsunami versus the tsunami in Japan recently, we know that society was different in those two environments, and that the Japan was really well prepared for tsunamis. They knew that one was going to come. They had big gates that would come across and close off parts of the city to prevent damage. So disaster health perspectives change depending on the society. Disaster then, as we've already highlighted, results in where we need to rely on additional support or resources from outside our normal jurisdiction, has an overwhelming response on our normal capability and capacity. As I said earlier, I'd probably argue that this hasn't been the case in Australia. There's probably a couple of examples where you could argue that, one being Cyclone Tracy was probably one of those examples. On a community level, and then on an individual level, there might be some decisions around patients, particularly from Bali 1 or Bali 2, about availability of blood products and those kinds of things where you may need to make decisions at an individual level, not necessarily at a community level. Other than that, we haven't really seen disasters. However, you could also argue that some of these events, which we have seen in Australia, such as Black Saturday, was a disaster. Well, it was a disaster for the immediate communities that were affected by the bushfires, and on particular Black Saturday. However, it wasn't really a disaster for the state. The major tertiary referral centres and the burn centres were not overwhelmed. They had capacity, they had beds available for burns patients, and they weren't used. This tells us that we weren't overwhelmed. Yeah? So from a health perspective within the state, and therefore probably nationally, it wasn't really a disaster as such. But it definitely was a disaster for those little communities. Having a look at other events up here, pandemic H1N1 was interesting. I call this kind of the disaster in slow motion. It took a lot of resources, a lot of time and effort of individuals and health services to plan, prevent spread of illness relating to pandemics. However, we didn't really put into place our disaster plans. We probably didn't do it quite as well as we could have done, and we're kind of lucky that it wasn't a severe strain of H1N1 or flu. We're also familiar with disasters that occur offshore, and this is a list of disasters in which Australia has provided some health assistance or some support to, and this is taken from the National Incident Room website. The National Incident Room is a federal government room situated in Department of Health and Ageing, where they monitor any kinds of disasters that occur within our region in which Australia may need to respond to or have some capacity in terms of their response. So these are some up here that you'll probably be familiar with. So I want to talk about willingness now. So we know a little bit about disasters. How many people in the room are willing to go to a disaster? Everybody? I would have assumed so, given the population of people I'm talking to. So we assumed that you all would be willing to go to disasters. We thought that would be the case too. And in the example of the Pacific tsunami in 2009, I was working as a clinical manager in an emergency department. And our health service said to us, we need to find a list of people who would be interested in helping out in this disaster. So we walked around the emergency department to all our staff, the graduate nurse, the senior nurse, to the administrative people, to whoever we could think of, and said, would you be willing to assist in a disaster? And of course everybody put up their hand. Likewise, in the 2004 Indian Ocean tsunami, people who were interested could ring up, I think it was then Foreign Affairs, and you would register your interest to say, hey, I'm willing, I'm a nurse, I want to go to this disaster, these are my qualifications, this is where I've worked, this is kind of what I've been and done, etc., etc. That was fantastic, overwhelming response of people that wanted to help. Interestingly though, when we pulled down the data from people who registered to help, or wanted to help or volunteer, we noticed a few things. People were willing